My name's Lucia Galindo, and I'm the Director of Operations for RehabOne Medical Group. We're a physiatry practice, so we're a multidisciplinary group. We have acupuncturists, chiropractors, yoga therapists, doctors of osteopathy, physical medicine and rehab doctors, holistic fertility doctors, and we treat pain, predominantly pain. As we've grown as a practice, managing the operations can be a little bit tricky, and we have so many different providers that we're trying to please every day. We've always dreamed of having a report processing department, but having the manpower proved to be a difficult task with either turnover, having to train staff, being out of the office for either vacation or being sick and whatnot. And so when we learned of DrCatalyst at last year's UGM, in Sacramento, we discovered that this could have been maybe a viable solution, so we decided to explore it, and we now have a report processing department in place. So this one person is responsible for faxing out all of our entire organization's reports, does an amazing job, and if she ever happens to be out, the team lead can assign somebody else and takes on that task of managing the backup people, so that the task is just seamless regardless of who's doing it. And even the team lead himself is trained to handle those transactions. So that allows for me to let my medical assistants practice at the highest level of their certifications, allows for my administrative staff to sort of excel in their departments, and it allows for us to continue to grow without the growing pains. Yeah. We've been able to allow for our administrative staff to take on other projects, right? So something that can affect a doctor's office a lot is a no-show rate. So when patients don't show up to their appointments, it's gonna affect your bottom line. And so by allowing DrCatalyst to take over these departments such as faxing out and receiving those faxes in and distributing them, we've been able to hold our administrative staff, because we have 5 offices, and so holding them now responsible for running no-show reports and following up on those transactions to get those patients back in is something we've always wanted to do, but we never really had the manpower or the woman power to do, and now with DrCatalyst we can focus on those things that again affect the bottom line. How about I start off with saying what it's not? It's not outsourcing. We've been able to take our team and just extend our team overseas. Her name is not Hannah, but yet we call her Hannah. And we really try to include her in all of our staff meetings. We try to include anybody that's been a part of our team from DrCatalyst onto our team. And I know that there's a fear, and we had it too, where we were like, well, are we gonna outsource? Like, how is that gonna affect our business? And what we found is we're just building a bigger team, and a team that has the same morals, has the same work ethics, and in some cases, right now, we have a licensed physical therapist, and because we are physical medicine and rehab, it's a huge plus for us to be able to have a physical therapist on our team that understands our terminology, understands our lingo, understands the importance of things to be done correctly, and that attention to detail. So I would say, do it.